Hi guys, this is Surgical Basics with Dr. Mac. Today I'm going to show you how to hold a needle driver.
This is a standard needle driver. A common rookie mistake I see is students try to palm the instrument and they don't do it smoothly. The idea behind palming is that it allows you maximum rotation of your wrist for throwing suture. But you can't go from the couch to running a marathon in a day, so practice the basics. Put your thumb and your ring finger in the instrument. Put your index finger on the stem of the instrument for added stability. It's optional, but you can rest your wrist on the patient to keep your hand from shaking when you throw stitches. Once you've mastered the basics, you can take your ring finger out, and this will allow you more rotation of the wrist when you throw sutures. Then, when you want to open and close the instrument to grab or release the needle, simply slide your ring finger back in. Practice makes perfect, guys.